Hi guys, I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Welcome to our back pain and sciatica workshop. We are going to teach you how to alleviate back pain without medications, injections, or surgery. So this is a very popular topic, especially coming out of quarantine when people were really sedentary. I think our cell phones tracked us to be 50% less active than we were in prior years. So back pain has really ramped up. Not that it wasn't a problem before, but now people are starting to address it a little bit more. And let's talk about how we do that. So let's talk about how or why back pain occurs. So, you know, if you guys were actually in the clinic and we were doing this live, which we're not, but that's when I would ask you, when do you feel your back pain? So a lot of people would respond standing, sitting, driving, sleeping, gardening, going from sitting to standing, these are some really popular ones that we list during back pain workshops. Doesn't mean that just because I didn't list yours, we're not going to talk about it, but I'm doing this to show you something. So if you know when your back pain is going to come on, and maybe you don't know every time, but if there's a trigger and you know, man, I can't sit too long, or I can't stand too long, or driving or whatever, this is kind of the neat thing that we're going to talk about today. So if your pain is reproducible, so that means you know when it's going to come on, or you have an idea that you can't sit too long, you can't stand too long, you can't garden, you can't lift things, you can't bend over. If your pain is reproducible, and that's what we call reproducible pain, we can make it hurt. You don't want to, but we can make it hurt if we have to. If you have pain that is reproducible, then you have pain that is reducible. All right? So if you have pain that you can reproduce, then we can reduce it. All right? So let's talk about how people deal with pain. This is the first thing we all do, is we ignore it. I get it. I'm over 40. I wake up with some sort of ache or pain every day. I'm not going to pay attention to all of them. That's how we all deal with it. Just going to ignore it. It's going to go away. A lot of times it does. Sometimes it doesn't. But this is the first stage of all pain. And unfortunately, this is a stage that can get us into a lot of trouble. However, I understand you're not going to run to the doctor with every ache and pain. This is my rule, 2 weeks. If you have pain that has been going on for more than 2 weeks, you need to get to the doctor. It doesn't have to be consistent over those 2 weeks. So if you're like, oh, you woke up with back pain, it's gone tomorrow, and then it's back the next day, that's still pain within that 2 weeks. All right? Pain that disappears on its own and never comes back, literally you can't remember the last time you had it. If you remember the last time you had an episode of back pain, that's pain that's not going to go away unless something happens, unless we do some more treatment. Okay? So 2 weeks is the rule. That's when I know that that pain is not just you slept weird or something happened. That's when I know we need to work on that. So then we get into the second stage, because pain that is ignored doesn't go away. So this is what we start to do now, is we alter it. So pain, we ignore it, now we alter it. How do we alter it? Advil, ibuprofen. Okay? Maybe we do heat, maybe we do some ice. We start to take medication. We start to do something to make that pain less. Okay, and a lot of times this can help take the edge off. That's what I always hear. It just helps me take the edge off. So, but this again, eventually, if you don't fix it, it's going to progress into something far worse. So the third way we can deal with pain is we can handle it. All right, now, this means actually finding the cause and fixing it. And let me tell you, the longer you take to get to this step 3, the more costly, the more time. The biggest thing people always tell me is, I don't have money and I don't have any time. I get it, neither do I. However, if you come in and, you know, and you've been having back pain for 3 weeks, you're in and out within a blink of an eye. That's easy stuff. We can fix that quickly. People wait forever to handle it. They come in, oh, I've been having back pain for the last 6 months. Oh, for 9 years I've been having this on and off back pain. And then they wonder why they can't fix it in 2 months. Or they wonder why it leads to surgery. People who ignore it and don't handle it wind up having more money to spend and more money and more time to spend. I always like to draw a reference to a leaky roof. Okay, at first you can put a little duct tape on it, it'll hold. Eventually that is going to come rushing through your house if you don't deal with it. That duct tape that you put on there, that's the Advil, that's the heat, that's the, oh, I won't run today. That's that duct tape. Yeah, you didn't deal with it, but you got by. No one really knows. You're good. Eventually it comes gushing through your ceiling, and now all of a sudden you've got a problem and you have to handle it. Waiting till you have to handle it is a costly decision in time and in money. So if you are someone that says, I have no time, I have no money, you need to handle it before it gets to a point where you have to handle it, and you will be forced to handle it. And we're going to talk about this right now. So those are the ways that people handle pain. So here's how people wind up in our office. And here's how, this is how all pain, unless it's a traumatic accident, unless you fell down the steps, unless it's a car accident, unless it's a workers' comp issue, this is how all pain progresses. All pain progresses. So we are going to call this outside ring. This is going to be running, gardening, lifting your grandchildren, things that are really things that you enjoy doing. Don't have to do, but things that you really enjoy. Okay, things that you are, again, not necessary, but you enjoy doing them. This inner circle here, we're going to call the driving, things that, you know, you can kind of get away with not doing, but you actually have to do them every once in a while. Sitting for long periods of time. Again, things that, you know, standing, kneeling, these are things that you can get away with kind of not doing, but you do actually have to do them every once in a while. This middle circle is things you have to do. Sleep, toilet. So people come in to see me usually somewhere between these two circles disappearing. And that is when it's going to take a while for things to go away. This is when you start to alter your pain and you ignore it. This circle starts to disappear. Okay, so now all of a sudden you can't run, you can't lift your grandchildren, you can't garden. Maybe you can only garden for 5 minutes. But if you think back, you're like, oh yeah, I used to be able to do X for a certain amount of time. Now I don't do it at all. Or now I don't do it as much. Okay? This ring starts to disappear. So when people come in and they're like, well, you know, it went away for a while. Did it go away, or did you just stop activities that aggravated it? It didn't go anywhere. Unless you fixed it, it didn't go anywhere. You just limited activities that would cause it. That didn't help it go away. It just stopped the progression going so quickly. But eventually, this circle starts to disappear. Now you're having pain when you're driving. Maybe you can't even put your foot on the pedal because the pain going down your leg is so bad. Maybe you have to get up every 5 minutes. You can't sit in church. You are constantly moving. You can't sit for very long. You're just in severe pain. This is when people start to come in, when this starts to go away, because now your quality of life has been affected. All right, and this is kind of when I say, where were you 6 weeks ago, 6 months ago, when that other circle was going away? Because that's when it's easier to handle. But people like to ignore it and alter it until this circle is either starting to be eaten away at or almost gone. And then some people just come in when they are like, oh, I can't sit, I can't even sleep, I can't get on the toilet, I can't get off the toilet. But that is usually the stages of pain and how it progresses. And how, if you identified it in the first stage, it takes you less time and less money to fix it than if you go and actually fix it in the second phase. And a lot of times, the options in the second phase are much worse than the options in the first phase. So catching it early, identifying it early, and handling it early are the keys to making this get fixed as fast and as cost effectively as you can, where you're avoiding those surgeries, those injections, all that. All right, so that's all about pain. Okay, so now we are going to get into the causes of back pain and sciatica. All right, so first cause, herniated disc. This is also called a bulging disc, a slip disc. All of these terms are used interchangeably, okay? So this is what most people come in with, is some sort of herniated disc. Why? It shows up on X-ray and MRI. This is the easiest thing to diagnose. Now I'm going to tell you I have 5 herniated, bulging, whatever you want to call them, discs in my back. I have no back pain whatsoever. 80% of Americans have some type of bulging disc. They don't all have pain, but 80% of them, when we run them through an MRI machine, has a bulging disc. Now, if I were to go to a doctor and say, I have back pain, they would put me in the MRI machine and say, oh, you have a bulging disc. That's why you have back pain. In reality, it has nothing to do with it, okay? So, while this is a very commonly diagnosed back pain cause, it is not a very commonly diagnosed reason for back pain. Now, you could have a number of different things going on, and the 4 causes that we talk about you may have 2 or 3 of them. That's very common in back pain, especially the longer you have ignored it, especially the further you are in those circles. That is when we start to get into multiple causes of back pain. So the first one is herniated, bulging, or slip disc. All used interchangeably. Technically they mean something a little bit different, but for now they're good. So I'm going to draw what this looks like. I am a physical therapist. I am not an artist. This is going to be horrific, but we are going to go for it. All right, so this is your disc. This is one of your lumbar vertebrae. So that's your low back down here, okay? And then we do this. All right, so, and then we have nerves, which are your spinal cord, running through here. So this is in your spine, and here's your disc. So what happens is when you have a bulging disc or herniated disc, this disc starts to push on those nerves. Okay, this is commonly happens when you have a disc that is bulging will cause numbness and tingling. Okay, it will cause numbness and tingling into generally one leg, sometimes into both. Usually when we're talking about both legs, we're talking about a different cause other than a herniated disc. So just be aware of that. Doesn't mean it's always true, but usually a disc issue, you're going to get words that are going to affect the nerve. Nerve irritation is words like burning, numbness, tingling. Okay? Those are herniated disc words. Those are pain going down your leg. All right? This most often, a herniated or a bulging your disc will cause numbness or tingling, some type of pain going down your leg. Could be down into the front of the thigh, could be into the back of the thigh, but it causes that pain going down the leg, usually on one side. This is really a very common diagnosis in women in their 30s and 40s. Why? Because this type of posture, where you're bending over and you're picking up kids, is one of the highest amount of pressure you can put on your disc, causing herniation. All right? The highest amount of pressure you can put on your disc is actually sitting in improper posture. So if you are sitting in improper posture and then you're bending over, you are most likely to have some type of bulging disc. But again, this is numbness and tingling going down. Your leg, you're gonna have some pain with bending over. But again, 80% of the population has these, but not 80% of the population has back pain. So if you go to the doctor and they order an imaging study, you're most likely going to have a diagnosis of a herniated disc. I would say probably 60 to 70% of the time people walk in here with a script for a herniated disc. It is no reason why you have back pain. And this is why people are a lot of times terrified to get that MRIs, because they're afraid this is going to be led to surgery. A lot of times, even if you do have this, you don't need surgery. Okay, so a lot of people are scared and they don't go to get that test done because, oh my gosh, my brother had a herniated disc and he needed all this surgery. A lot of times this isn't even the cause, okay? But it shows up on x-ray and it shows up on MRI, so it's very easy to diagnose. All right, so then we have, the next one is stenosis. DDD and DJD. Okay, so stenosis, DDD, and DJD. DDD, here's a tongue twister, degenerative disc disease, gets me every time. And then DJD is degenerative joint disease. Okay, so this is a wearing away of the joint surfaces and the disc. Everyone over the age 18 is going to show this on an x-ray. Okay, so the stenosis is a little bit more of an intense diagnosis. So stenosis is going to be, and here's my lovely drawing again, is going to be more of a narrowing. Where these nerves come through, it's going to be a little bit more of a narrowing. So it's actually kind of squeezing the nerves, okay, because you're losing some of that distance in there, which is where people like to lean on a shopping cart, and that makes it feel better because it opens this gap up a little bit to allow those nerves to run through. But this is going to be, again, another common diagnosis. Stenosis, not so much. DDD and DJD, if you've had an x-ray and you're over the age of 18, I guarantee you somebody has said you have DDD and DJD, especially in your spine and especially with back pain. I can tell you right now, stenosis, yes, but DDD and DJD I have never seen as the sole cause of back pain. So when I hear people be like, I have arthritis in my spine, there's nothing anybody can do. You're right, I can't fix the arthritis. I cannot make this better at all. However, that is very rarely the cause of your pain. So understand that a lot of the imaging we have for low back is not accurate in diagnosing the pain. There are certain things we need to consider, and we need to figure out if that is the actual cause of the pain. But at the end of the day, this is not the cause of the pain most of the time, okay? And in fact, I've never seen them. I've never had a DDD or DJD that I can't completely resolve the pain with because it has nothing to do with the arthritis in the spine. Everybody over the age of 18 has arthritis. Sometimes it causes pain, sometimes it doesn't. All right. Let's go into the third cause of pain. So this is one of the really big things that cause pain. SI joint. All right, so the SI joint. This is pretty easy to diagnose. However, there is no imaging study that will actually diagnose this, which is why it's often overlooked and it never gets diagnosed. So the SI joint is right here. So here's your pelvis, or here's your hip bones, and then here is your tailbone. Okay? So right on either side, you have two SI joints right here. That is called a sacroiliac joint. While they show up on x-ray, the dysfunction that happens with them does not. So this SI joint causes a lot of pain. If you have ever said, you know what, I have a pain right here. Now that pain may spread outward, that may spread downward, that may spread up the back. It may spread all over, but if you say I have a pain right here, that is an SI joint dysfunction. Now, that's not to be confused with a pain in the butt. All right, so if you have a pain in the butt, that's not SI joint, that's a piriformis syndrome, something totally different. But when you have pain right here, and a lot of people, when we do these seminars, are like, yes, yes we do, yeah, absolutely, right there. That is an SI joint dysfunction. All right, that is an SI joint problem. And this is a problem because, again, it's not commonly diagnosed because you can't find anything wrong with it on X-ray or MRI. However, when we put our hands on you, it's very easy to diagnose. It's very easy to figure out exactly what is going on, because these are all muscles that come in and attach on the hip and on the SI, and that causes pain. And that pulling, if there's knots in here, that pulling can cause issues, and that can cause the radiation out into the hip. It can also cause pain all the way running down the leg. Okay, so that is a major issue that is often overlooked and is often not addressed, is this SI joint. All right, and then the fourth cause of low back pain is compensation. This is probably what we see the most of, okay? Compensation. And what is compensation? So compensation is ignoring pain for too long and winding up with knots, okay? Knots in the muscle because you ignored the pain. This, in combination with herniated disc, in combination with DDD, in combination with DJD, in combination with SI joints, is what we treat the most of. And until we get rid of this, nothing works. So I don't care how many injections you have, how many surgeries you have, until you get rid of muscle compensation, nothing will work. And how do we do that? We get our hands on you. Okay? It is important that you understand that fact, because so many people come in and say, I had back surgery and it failed. Well, did you treat the muscle compensation that happened beforehand? No. Well, then there's the problem. So many people come in with leg pain that never was alleviated with injections or surgeries, or they went to pain management, they keep getting injected and there's no relief. Did you fix the muscle compensation? Muscle compensation occurs without you knowing it, and that's the hard part. So when you're shifting around in your seat, that's muscle compensation. Your muscles are not being used in the manner that they want to be used. Okay? When you have to get up and you have to stretch, it's because there are knots in your muscle. All right, and those knots are causing you pain. And without addressing it and solving it and fixing it, you can't solve any of the other problems. So that's why back pain is so misdiagnosed and so poorly treated, because people are getting injected. And you may have a herniated disc, but if you don't address the muscle compensation that happens because you were in pain, how many of you limp because of back pain? How many of you get up and you're like, okay, I just have to stand up? That's all compensation. If you have to stand and you're like this, even just for a minute, you are compensating. You are calling on other muscles to help you stand up. The hardest part is you don't even know you're doing this. Your body is doing it for you. It is just saying, just get me out of pain the fastest way I can. So any type of movement that's out of the ordinary is muscle compensation. And then when you actually do it for a long period of time, like 6 weeks, it becomes the new norm. So now your muscle's like, oh, okay, like I have to, start getting up like this, and then I have to change the muscles that I use. Well, then those muscles get too tired. And then it's this snowball effect. This muscle gets too tired, and then that muscle gets too tired. All right, and then you have this pain that's unsubsiding, and unless you have a full-blown and a full approach to the whole situation, it's going to fail. And that's why we fix back pain without injections, without surgeries, without medications, because we address this part that so many other places do not. And stretching, while I'm going to show you some stretches and some things you can start to do at home, if this is bad enough, stretching's not going to get rid of the knots. I compare stretching a knot to pulling on sides of a string. Okay, so if you tied a knot in a string and then pulled on the sides, you're not going to pull that knot out. It's just going to get in there and deeper and deeper and deeper. That's what stretching does to knots. Okay, you actually have to get them broken up, and then you can stretch them out, and then you can make them go back to the normal length. But until that happens, they're going to get shorter and shorter and shorter and compensate more and more and more and more and more. All right, so really important to understand muscle compensation, because this is primarily what we treat. This requires a hands-on treatment approach, and it also is probably the number one reason back pain treatments fail, even the most aggressive ones. And the sooner you get in, the less compensation you're going to have, the less time you're going to spend in therapy, the less money you're going to spend. All right, so what we're going to talk about now is what you can do at home. Okay, so we have a couple things that I want to show you that you can do at home. So the first one is you're just going to do some back extensions. Now, if this increases your pain in any way, if this causes any additional pain going down your leg, you want to immediately stop. You're going to put your hands on your back and you're going to lean backwards. Nice and easy. Okay? So again, your hands are on your low back and you're supporting it, and you're going to lean backward, look at the ceiling, and then come up. We'll look at the ceiling and then come up. You should notice a minimizing of pain. Okay? It should not increase anything. These are not no pain, no gain exercises. So if you are feeling pain, then you stop that. Okay? The next exercise I'm going to show you is just a simple figure 4 stretch. So you're going to sit here in a chair. All you want to do is just cross your ankle over your knee, sit up nice and straight. This may be the stretch for you. This may be enough. Okay? You want to sit up nice and tall, and then you want to lean forward. Okay? Now, if you feel the stretch when you're here, you're done. But if you don't feel anything, you want to just sit up nice and straight. You want to lean forward. You don't want to slouch down and reach over your legs. Okay? That's not going to help anything. All you're going to do is just sit up nice and straight and lean forward. Now, this is also actually a test you can do. So this, see how my leg is almost parallel with the floor? That's how your leg should be. And it should be symmetrical on both sides. So we see a lot of people that come in and their legs up like this, or maybe they have to help their leg up. That's not normal. This knee should not be up high like this. This should be flat. And it should be flat without you having to push it down. Knees that you have to push down to get flat are not flat knees. If it's going to push down and then spring back up once your hand goes off of it, that's the sign of something going on. I don't know what's going on. We have to diagnose this, but there's something going on if your knee is up like this. You want to make sure that your leg is relaxed and that your leg is almost parallel with the floor. Again, nice and easy, lean forward, okay? Really important to make sure that you're doing that without slouching, because again, like we talked about earlier, the highest amount of pressure you can put on your discs is sitting like this. You are going to herniate them, and then sometimes you will have that herniation that, you know, is going to cause severe pain going down your leg. So that's it. I appreciate you listening to our back pain and sciatica webinar. If you would like a free consultation with one of our doctors of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in and find your cause of your back pain and sciatica. Thanks for listening.